Our next speaker this morning is Nuala Doherty. I'm going to do two things at one time, which apparently a man can't do. But so Nuala is a great champion of children's services and has worked in the area for a long time as director in the old world, as director of children's services in the North Eastern Health Board. In the newer world then as Director of the National Education and Welfare Board before moving on to the Centre for Effective Services. So without further ado, I'll ask Nuala to speak. Thank you.
Thanks very much, Aidan. And good morning, everyone. It's really a privilege to be here this morning, and I can't believe it's 40 years since Teen Counselling was founded. That makes me feel very old indeed. My initial clinical placement was in Mater Dei, which was a terrific service, and the Teen Counselling service was attached to that. But Mary, that was in the very early days of Teen Counselling. So congratulations to you, 40 years on the road in existence and on the evidence journey, some of which I'm going to try and talk to you about this morning. So John has teed it up nicely for me, and he's taken at least some of the angles I wanted to address, but that's helpful. And what I want to talk about is designing and implementing effective services. And I've tried to do it with a sense that I was speaking to an audience of practitioners. So you can tell me afterwards on the feedback piece if I've hit the spot, because it is hard for all of us to translate from the research into practice, into what we actually need right now, today, for our service. But I do know the audience is packed with people who are working in services for very vulnerable young people. And I know something about your struggles and challenges in that world, because I have done some of that in my past. So it's in two parts, and again, John teed it up quite nicely. The first part is about designing effective services. How do you do that? And I'll spend some time looking at that business of evidence. And again, Tess, wherever you are, I couldn't figure out where you are, your kind of contribution addressed some of the challenges for us in evidence-informed work. I'm going to look at how you put evidence in context and also give you probably some reminder, because you will know about outcomes, but some reminder about the importance of working for outcomes, not outputs and activities. And finally then, in that section, give you just a brief glance at a tool that might help you to describe the outcomes you're trying to achieve in your service. The second part is around implementation, and John mentioned that, because we now know, and we have invested very significantly in the evidence base for services, but the outcomes are not improving to the same degree. So we have, and internationally and nationally, are now more aware than ever that if we don't concentrate on how we implement the evidence, how we implement the services and the new innovations, that we will not get the outcomes that we need. And actually there's some helpful things, hopefully for you, that I can say about implementation. Just a quick word about the CES. We're small, we're an all-island organisation. We're funded by the Minister's Department, by the Department of Community and Environment, and also by Atlantic Philanthropy. And we're based in Dublin and Belfast. This is a busy slide, but all you need to really look at is the bottom line. What we were set up to do was to help policymakers, people in departments, and also practitioners to use evidence effectively and to translate that, because some research is not accessible to practitioners, not just because it's inaccessible or written inaccessibly, although some of it actually is, but actually busy practitioners don't have the time or sometimes don't know how to source the evidence. So translating that into ways that you can use, and then also implementing it. So we had an interesting input from John on the evidence-based definition. So there are at least two schools of thought, the evidence-based approach and the evidence-informed approach, and Tess mentioned that. So I won't dwell on the evidence-based one. It is very high level. It is a high category of scientific evidence and a kind of gold standard of research, but not accessible to everybody. Everybody can't have the kind of gold standard RCT evaluations, nor do we need them. An evidence-informed approach is the one that we subscribe to in the Centre for Effective Services, and hopefully this will be helpful to you because it is trying to draw together the evidence, and again from the previous speaker, the evidence from service users. That is evidence that needs to inform your service, what they are telling you about the service. Evidence from the practitioners that you yourselves are actually hold a huge amount of evidence from your experience and from your practice. And then also the evidence from research. So those three things, when you put them together, come together to contribute to the evidence-informed approach. If I achieve nothing else, but you leave the room this morning feeling that you are on the evidence journey and that you are evidence-informed practitioners, I will consider that that's a good day's work. So this is, again, just a description. This is what we call our evidence triangle. And we say at the centre of evidence is research. But also there's consultation with service users, consultation with peers, consultation with other practitioners. You gain evidence from practice wisdom, and I've said that. Those of you who have had the experience, you learn from that. And also any inspection report you have had, there is learning. Any reviews of your service, there is learning. The implementation of any new standards, there is learning. That's all together with practice wisdom. And also policy. Policy is very strong on theory, and there is learning for evidence in policy. So our understanding of the best evidence is where you draw it from all the sources, those sources to inform your practice. And we had a very good example of that in Northern Ireland this week, where we were working with Sure Start, and they're an organisation, an early years organisation that's area-based and working with very vulnerable families. And they were interested in how they could engage better with fathers, which you will probably identify with. So they did three things. They went out and asked fathers, 160 of them, what do you need to engage? We're not engaging well with you. What things would help us to engage with you? And then they had a speaker who had years and years of experience of working in men's groups, and he spoke. And then we brought the evidence from research, what the research was telling you about engaging with fathers. And it was very heartening that all three concurred and brought together. So what did we learn? And some of it also is, or what are these combined messages telling us? They're saying that men learn differently to women. And they also don't necessarily want to come into a service where all of the materials and all of the posters are where they're absent from them. So where there are pictures of mothers and children or babies and mothers, and they can't actually see themselves in this. And also they prefer events rather than discussions for the most part. And it's also true, I suppose, for the adolescent boys. They're not great talkers. And so they like a different kind of method of getting their information. What was heartening, though, was that the gender of the person running the service or the group did not matter. So it didn't matter. They said, we don't need men running the groups and we don't need men running the services. What we need are competent people that we can relate to, who are empathic. And that is a thread that runs really strongly through all the research, is the actual importance of the clinician in terms of their skill set and also their ability to connect with their client group. So the what works, and again, this is kind of obvious to you. Everybody wants to know what works. And in a way, it's kind of the simplest of questions. And we get a lot of questions about just give me the 10 programmes that are the best programmes and let's be done with it. You've done all this research. Whereas actually, you know that it's a much more complex question. And so that it really is for whom, in what circumstance, at what point in time, using which approach, under what conditions. So it actually isn't, as John said, one size fits all. There isn't one magic answer to what works to get better outcomes for children. And I talked about the evidence journey. And again, this has been referred to by previous speaker and also by Tess. I think if we see ourselves rather than on is it the evidence-based journey or is it the other, that it's actually all connected, and that good practice where you have a community of judgment about what works is also part of the evidence journey. And then you have promising approaches that mightn't have the full very strong research, but the findings but the findings are consistent in relation to evaluations you've had. Then more research strong, evidence, and then evidence-based. So I suppose the advice I would be offering you is to try and strengthen the evidence in your service and strengthen your journey on that evidence journey. So a lot of this has been said, what are the evidence? And I'm just go through it. It can improve outcomes. And that is why we're here. We are not here just to deliver the services. We are here to get better outcomes for children, so that you can do no wrong. And I think that is really important. I mean, evidence is important because not only may it not be having a fantastic impact, but actually it might be having a negative impact. And there is some research to show that some group interventions with young people who had antisocial behaviour actually made them worse, made the antisocial behaviour worse. So actually we need to know what the evidence is for interventions. And the rest. It can increase the funding and sustainability. And again, the Minister mentioned that we actually need to know a lot more about what things cost. And if things are sustainable. And actually, I'll talk a little bit more about this later, not to start things without having these questions at the very beginning, because we sometimes are carried away on the latest, newest, greatest, and actually then 2 years later we're thinking, actually we can't sustain this, we haven't either the people to do it or the money to do it. And then if you can link the cost to the benefits for the client, that is in the ideal world. We have a journey to go on that, but actually we need to be doing it. And establishing what's known, that'll identify the risks. Okay, so the challenges, John mentioned a number of these. I won't mention them because there are contested definitions. You do have to have a level of expertise to weigh evidence and select it. And sometimes it's contradictory, the evidence, and sometimes there's a dearth of it or it is incomplete, and particularly in complex situations. As with everything, we tend to research some of the things that are easiest to research. So some of the really complex community things with very complex client groups, there isn't a very strong evidence base. And then the best evidence won't bring you the outcomes without good implementation. So this was also mentioned earlier, you need the context. And that was really interesting around the parenting group where actually you need to go out and talk to the community before. You may have a fantastic idea and a fantastic intervention that you want, but actually you need to talk to your community and client group to see that it is what is needed. And certainly we had evidence of one of the services who had the money for an intervention and wanted to do a literacy programme in schools. And actually when they consulted with the teachers and consulted with the parents, what they wanted was a programme to improve the social and emotional well-being of children. So without that consultation, that they would have been off doing the literacy programme. And there are other examples. So I'm going to talk to you a little about outcomes. Now, forgive me if this is cold to Newcastle, but we talk a lot about outcomes. We have 5 national outcomes that this country has identified as its outcomes for children. And I'll tell you them just in case you don't know them, that they are healthy, that they're supported in active learning, that they're safe. Now I'm summarising. That they're economically secure, and that they're positively networked and participating in society. So each of your services should be able to identify with at least one of those outcomes. And the more explicit you can be about saying, that's us, we're here, and we're actually improving the learning outcomes for children. So at one level, while it is good and important that you are able to say how many courses you're running, how many clients you're seeing, how many whatever groups you're running, you actually also need to be able to say what impact is that having? What effect, what results is all that having? And that is what we mean by an outcomes approach. So there are short, medium and long-term outcomes. So for example, in my previous job, we wanted to increase children in active learning in the NEWB. And actually our outcomes were to get and keep children in school. But some of the soft outcomes or more short-term outcomes might have been to improve their literacy, because we know that a lot of children drop out of school because actually they can't cope with the curriculum and their learning isn't sufficient to keep them there. And also their attitudes towards school. So behaviours and attitudes are also short-term outcomes, but that you would actually be focused on what is our service trying to achieve. And recording that. I'm going to talk to you about this thing called logic models. Now, when I arrived in the Centre for Effective Service, they did my head in with logic model. And it took me a while, but actually I'm a convert. Because what it is doing is it's starting with what you want to achieve in your service, what results you want to get, and it's working back to say what activities will support that outcome, and then what inputs you have. So you have inputs are your resources, your staff, your money. The activities are what you're actually doing, and then the outcomes is actually what you achieve as a result of it. So we need to be able to, and the beauty of the logic model is that it actually puts it on one page. So you can actually see, it's actually a terrific accountability thing. And funders actually love it because you can talk about your service in a really succinct way and say, actually, this is what we want to achieve. This is what we're doing. And this is what we're measuring. So actually the evidence plugs into that. So the inputs are what we invest. The outputs are to whom, who we reach and what we do. And the outcomes are what we achieve. The evidence informs that, and then you can actually monitor it and evaluate it. So when we're thinking about, do we need an RCT? Well, if you had your logic model and actually you were able to see, are we meeting the outcomes that we actually said that we would do? That is a really strong start. And I think John mentioned really wisely, think of yourself as collecting data. Don't think of data as something that you send back up the line and that nobody pays any heed to. Use data. It is an absolute gem in terms of informing you about your work. So data strong, and you also need a narrative. So you need the numbers and you need a narrative, a story. And both of those together form very strong data. The implementation gap I mentioned earlier. And this is the slide that's saying, for those of you who can't see it, in the middle, stage 1 from this very scientific experiment, and then at the end is a very scientific experiment. And so the left-hand side is the evidence, and then the right-hand side is the outcomes, and then a miracle occurs. So we have, in many ways, not paid attention to what is in that miracle. And I would be as guilty as anything because I absolutely didn't know. So essentially, when I was in the Northeast, as Aidan said, I commissioned a lot of services. And I looked at the evidence for them, I sourced the money, I put together the proposals, and in some instances, I even recruited the staff for them in those days when we were recruiting staff. And then I let them off with it. I said, that's over to you now. I've done my job. And actually, I didn't realise that the work of implementation was only beginning then. So when I would come back a year later to see how they were getting on, and actually the service was only half up and running, or they didn't have the level of referrals they had, or there were issues around interagency work, you need to actually systematically support an intervention. And I'll tell you that. So at its simplest, implementation is carrying out a plan for doing something. So you have a plan and it's how you do it. Now, it sounds simple. It actually is quite complex, but hopefully I'll help you with some of the key pieces of it. Because it involves changing behaviour, and now for most of today we've been talking about how to change the behaviour of clients, but actually implementation involves changing the behaviour of staff. And we know that changing behaviour is extraordinarily difficult. Not only are you changing the behaviour of staff when you're introducing new interventions, but actually you're also changing the behaviour of the organisation. So it's really a systems change, and that is really complicated, and you have to kind of focus on it. So this again is just telling you we have the best evidence, and actually we have, as the Minister said, a really improving and strengthening evidence base, Irish evidence base and international. I think both are important. And we have the services, but we actually do need a bridge, which is implementation, to help us to get the better outcomes. I won't do that one. So, implementation drivers. They call them, this is a model, and I will decode it for you because that's my job, I think. So this is a service that, again, we like triangles, and it says that implementation drivers, on the left-hand side, there are competency drivers. And really that is that if you're implementing a new thing, now, in your heads, in every one of your services, you are implementing something new. It could be a new procedure. It could be a set of standards. It could be a new programme. It could be you've had a review that has pointed out some weaknesses and you need to improve it. You're implementing something. So have that in your heads as you're identifying with this as I'm talking you through it. So the competency drivers are what the organisation does to improve your capacity and to support the clients with the change. So it's not only can we change the clients, but it's actually how do we support the staff to help to support the clients to change. The second one is organisational capacity. So how can the organisations support the staff implementing it? And the third important ingredient or driver is leadership. You actually need a significant amount of leadership to actually see and innovation through to implementation. So on the competency drivers, we have three. And selection may or not. There are not many people in the position that they're able to make selection of staff. You have your existing staff, and that's your resource. The next one is training and coaching. And actually, I think it's really important. I mean, it was mentioned previously, we have to invest in training. Because if we're expecting a transformation of services and change, that not to invest in the workforce, not only is it foolish, you will not get the changes you need. But we also need to think about what kinds of training we're offering. And you need a combination of, it's not just a matter of taking people away from work and giving them a day training or 2 days training and expecting them to come back and be able to implement a significant thing. They can't do it. The evidence is not there that taking people away and returning to the existing service, that they're actually able to bring change. So there's that, and probably coaching is seen as much more supportive mentoring coaching, where you're actually needing to get improved skills or changes in skills. People need on-site support with that. The organisation pieces, and again, they're a bit obscure, and I'll try and decode them. I think the Minister mentioned this morning, our agencies are so interconnected. We are not working on our own. We're not on an island on our own. So organisational systems in systems intervention is really about can we get the external agencies and the other agencies in the rest of the services to support the innovation. So, for example, if you're in residential care and you are trying to introduce a new intervention for managing really difficult behaviour in young people, if you do it to the best of your knowledge, you prepare your staff, you support your staff, you coach your staff, but you haven't got the field social workers on side, that will not be supported. So you actually need to make the connections to the other services. You need administrative support for your intervention, and you also need data systems. So everybody groans when you say this, but actually you need ways of collecting information about how you're doing. And the final piece is leadership. And actually, it's not just one kind of leader, and I'm sure all of you can have in your heads and have had some experience of the best of leadership and the worst of leadership. But actually, you need leaders who can resolve existing issues, which is the technical side of it, who can resolve existing problems and sort them out for you. But you also need leaders, and they're called adaptive leaders, who can actually do some blue sky stuff with you too and resolve things that are new. So there's actually a quite spread, and it is a critical component. Now, I'm not saying you won't have good implementation if you don't have every one of those, because actually you won't have them. But what I'd like you to be able to think of is, look, if I'm implementing something, I need to think more about than just what it is I have to implement. It's the how you're going to do it you need to give consideration to. So practitioners in implementation, you need support for it. You need supervision for it. And the supervision you need is not just managerial supervision about how many cases. You need good clinical supervision, and you should be requesting it and insisting on it. Oops, I've gone on. The others you probably saw, and I'm probably running out of time, Aidan, am I? So in the Centre for Effective Services, we have some resources to help you. Not a huge amount, but we have some. Look at our website. We have a What Works process, which is a 360-degree process with a service or an agency that looks at how evidence-informed you are and helps you to strengthen your evidence base. And we have an online resource for youth workers, if there are any youth workers in the audience, and they're based on the national standards. And we have a lot of resources on implementation. So it is worth having a look at that. And there are, I'm going to move because it is the end, I'm sure. There are other resources. And actually, you know, you've got to start using the kind of online resources. And I'll make a reference to this organisation, IRIS in Scotland, iris.org.uk. And what they do is they support social care and social workers to do their job. And actually, they have some evidence reviews. So they summarise the evidence in a really simple way, so that actually you don't need to wade through loads of journals. So when I was looking at this in the last week, what I was struck by was, for an audience like you, and if I can find it now, they had evidence summaries on understanding suicide and self-harming groups of self-harming among children in care and care leavers. I mean, how good is that to be able to, it's like 13 pages, and to get a summary like that. They also have effectively engaging with seldom heard groups. And I thought seldom heard was really a wonderful phrase, because we used to call them hard to reach. Well, they're not hard to reach. We just don't hear them. So, and they have a lot of other resources. And there are some other, sky.org also is very good. You can go on, they are apps, they have resources, and they have ways of summarising the evidence that will be of value to you. Sorry about the rush, but hope that was useful. Thank you.